Massachusetts.
Thank you, Mr. President. Mr. President, I'm just going to follow up on the statements made by Senator from Connecticut, Mr. Blumenthal, and the Senator from Hawaii, Mr. Schatz. They have laid out in eye-watering detail the problems that the Republicans are creating by their attempt to repeal the Affordable Care Act. What Senator Schatz and Senator Blumenthal did was just get to the heart of this matter. What the United States did for 100 years was to not run a health care system, but to run a sick care system. A system that spent 97 cents on what happened after people got sick, and only 3 cents of every dollar on trying to prevent people from getting sick. For the first time in American history, that changed in the Affordable Care Act. What President Obama did, what America did, was to create a prevention and public health fund. And that fund in the Affordable Care Act is spent on prevention programs. They're spent on looking at people who could get asthma, diabetes, heart disease, obesity, high blood pressure, stroke, die from too much smoking, and just say, for the first time, in a comprehensive way, that the United States was going to put programs in place that would prevent people from getting the diseases that every preceding generation of Americans had suffered from. That's what the Prevention Fund is all about. That's what the Republicans are going to repeal, take off the books. This fundamental change to the direction towards prevention, towards wellness, that all of Americans, of all generations, want to see remain on the books. Now, in Massachusetts, if you're in New Bedford or Fall River, if you're in Springfield, those programs target racial minorities. They target low-income families. They target seniors who would otherwise be vulnerable to disease, which we could put prevention programs on the books. That money is just going to be sliced out of the federal budget. Now, what will be the consequences? Well, quite clear. It's going to cost America a lot more money. Because, for example, my father died from lung cancer. 2 packs of Camels a day. 2 packs of Camels a day. How many other fathers and mothers, sisters and brothers died from a totally preventable disease? Well, ladies and gentlemen, for the first time, this prevention fund put in place the kind of funding on a consistent basis, not just for anti-smoking programs, but for all programs across the books. I'll give you a good example. Back in the 1930s, no women, for the most part, died from lung cancer in the United States. But in the 1950s and 60s, the tobacco industry hired the smartest PR person in America. And this campaign basically said, "You've come a long way, baby. You have an equal right to get cancer as your husband or boyfriend or father or brother." And 20 years later, unbelievably, women began to die in the United States from lung cancer at a rate that was higher than the number of women who were dying from breast cancer. Now, that's a public relations success of the first and highest magnitude. We didn't have prevention programs in place. We didn't have a warning system to say to women, to say to kids, this is dangerous to your health. And what did we see? We saw just about every family in America with somebody who died from lung cancer. Pretty much every family. Totally preventable. Well, inside of the Affordable Care Act, we have this huge, great, innovative breakthrough, a health and prevention program that can be used in every city, every town, every state across the whole country, targeting the most vulnerable, the most likely to be targeted, the ones that are most likely to be engaging in dangerous behaviors that are otherwise preventable. We've cured most of the diseases that our grandparents died from. The diseases that people die from today are the diseases that they give to themselves. They are behavioral choices. They are environmental situations into which they are placed that then result in them, unfortunately, contracting the chronic diseases that wind up first harming them and ultimately killing them. What's a good example? Well, a good example is opioids. Opioids is now a killer of a magnitude that is almost incomprehensible. In Massachusetts, 2,000 people died in 2016 from opioid overdoses. Now, we're only 2% of the population of the United States of America. So if you multiply that by 50, it's 100,000 people dying from opioid overdoses if they died at the same rate as people are dying in Massachusetts. 100,000 a year. 2 Vietnam Wars worth of deaths every single year from opioid overdoses. If ever there was a preventable disease, if ever there was something that was completely and totally subject to having programs put in place that could help people avoid ever getting into that addiction situation, or once they did, giving them the program money which they need, then opioid addiction is it. Well, what the Republicans do here is they're just wiping it out. They're wiping out that prevention fund. Moreover, just for the sake of understanding how incredible everything that they are considering is going to mean in terms of prevention of opioid disease, Medicaid right now pays for 1 out of every $5 for substance use disorder treatment in the United States of America. In other words, without this prevention fund, without Medicaid funding, the only choice for these families is either getting help or getting buried. That's the bottom line. And what the Republicans are doing is just wiping out the help. And so the option is going to be not just 2,000 in Massachusetts multiplied by 50, 100,000 deaths a year. We're just going to see this number skyrocket. Because without public health, without prevention programs, this is an inexorability. It is an inevitability. This is the future. This is just a repetition of everything that America did for the preceding 100 years before we put the Affordable Care Act on the books. And it doesn't make any difference whether you come from Connecticut or Hawaii, from Virginia or Michigan, from Massachusetts, or from any other state in the Union. There are no barriers to opioid overdose, tobacco deaths, obesity, all of these preventable diseases. It's all coming as a preview of coming attractions to families all across the country. Here it is. This is what the Republicans are promising you. Your family, once again, exposed. And listen to this number. When the Affordable Care Act gets repealed by the Republicans, if they're successful, listen to this number. 1.6 million people who right now are covered for substance use disorders will no longer have coverage. Let me say that again. 1.6 million people who have coverage for substance use disorders will no longer be covered. So you have the prevention fund over here, you have the insurance over here, both gone. So, ladies and gentlemen, these Republicans, it's almost unbelievable. If you kick them in the heart, you're going to break your toe. You're looking at the most vulnerable people in our country. You're looking at the children. You're looking at people who have substance abuse disorders. You're looking at people who otherwise would never have smoked a day in their life if the prevention programs were in place. You're looking at people who would never have to suffer through a life of obesity because the programs were put in place. And what are they saying? They're saying, we're going to substitute and create a new program. When? Well, maybe soon. Maybe just around the corner. Maybe next year. Maybe whenever we get to it. And what do you say to those families? What do you say to them? Well, you know, this isn't just health care. This is also hope. This is also hope for these families that have chronic diseases. These families that have diseases that were otherwise preventable. And what the Republicans are saying is, we're just going to pull a bait and switch on you. We're going to repeal right now and replace at some point of our choosing in the future, even though we have harbored an ancient animosity towards the creation of any national law in the first place. And the American people are supposed to gullibly accept that argument. Well, we know what they have always wanted to do, leave all of these health care programs from Medicare and Medicaid and Social Security as debt-soaked relics of the programs as they had been created by Franklin Delano Roosevelt, by Lyndon Johnson, by Bill Clinton, by Barack Obama. They have always harbored that animosity towards those programs. This is just the beginning of an assault upon generations of promises to American families who have been transformed by these programs. Let us fight hard, my colleagues, to make sure that this prevention fund is not taken off the books. It is the transformative way of looking at health care, which the Affordable Care Act introduced into our health care system. I thank my friend from Connecticut, Mr. Blumenthal, for leading us on this charge, Senator Schatz, and Mr. President, I yield back the balance of my time.